Beginning at 50 years of age, men and women should be screened for colorectal cancer. Why? Because regular screening saves lives. In Delaware, most colorectal cancers are detected in what are called regional or distant stages. That means that the cancer was found after it had spread to other places in the body from its original location in the colon. But colorectal cancer can be prevented by getting regular colorectal cancer screenings. Talk with your healthcare provider about two of the screening methods available: a colonoscopy and a fecal immunochemical test, also known as a FIT test. A colonoscopy is a procedure that is performed by a healthcare provider. A fecal immunochemical test is a test you perform at home, but which one is right for you? For a colonoscopy, on the day of the procedure, you will go to an outpatient facility, dress in a surgical gown, and be briefly sedated. The doctor will use a long, flexible, lighted tube to check for polyps or cancer inside the rectum and the entire colon. During the screening, the doctor can find and remove most polyps and some cancers. This test is recommended every 10 years. A fecal immunochemical test is for those at an average risk for colorectal cancer and can detect blood in the stool. For this screening, you will receive a test kit from your healthcare provider. At home, you use a stick or brush to obtain a small amount of your stool and put it on the card. This is the stool sample that will be tested. You will return the test kit to your healthcare provider or mail it to a lab where the stool samples are examined for blood. The FIT test should be performed once a year. People at increased risk of colorectal cancer might need to start colorectal cancer screening before age 50, including those who have had colorectal polyps or colorectal cancer, or have a close relative who has had colorectal polyps or colorectal cancer, have inflammatory bowel disease such as Crohn's disease or ulcerative colitis, have certain genetic syndromes. Talk with your healthcare provider to determine if you should begin screening at a younger age. If you don't have insurance or your insurance does not cover a colorectal cancer screening, Screening for Life can pay the cost of the screening for you. Talk to your healthcare provider today or visit healthydelaware.org to get more facts and to get help scheduling a colorectal cancer screening. It could save your life.